Oh, hello there. My name is Dr. Kat. How are you today? Good. You're here for your cranial nerve and ear exam? Okay, perfect. All right, can I start off with your first name? Okay. And your date of birth? Okay. Any history of any diseases? Okay. How's your taste and smell been lately? Pretty good. Okay. And how about your hearing? Any tinnitus or ringing in the ears? Okay. And do you ever get dizzy when you stand up? Okay. And do you see any floaters ever? And if you're not sure what a floater is, it's basically a little black or white little flyaway that you can see in your eye when you're looking, and it's just like goes back and forth. You don't have any of those? Okay. Any recent diet changes? Okay. And are you in any pain right now? Perfect. All right. Any pain in your ears? Okay. So just a general checkup then. Gotcha. All right, let's get started. So I'm just gonna start off by checking your heartbeat. I'll just be looking for a strong heartbeat today. Okay, so I'll just have you breathe in and breathe out and breathe in and breathe out. Very good. We'll do that again. Breathe in and breathe out. Good. I'm gonna go ahead and check your lungs at the back. Okay, breathe in and breathe out. Good. I'll check the other side. Breathe in and breathe out. Okay, no crackling in the lungs, so I'm not concerned about them, and your heartbeat is very strong. I'm going to go ahead and actually check your pulse, and by doing so, I'm going to place 2 fingers on your neck. I can feel my pulse right now, so I'm going to be looking for yours right here. So just breathe normal. Breathe normal. It's okay. You can just breathe normal. You can feel safe. Everything is okay. Just taking your pulse. Okay. Very good. Now, I want you to make a few facial expressions for me. So can you smile? Good. Frown. Good. Puff out your cheeks. Don't let me close them. Very good. Can you stick out your tongue? Move back and forth. Perfect. All right, I want you to raise your eyebrows. Don't let me push them down. Good. Now I'm going to pretend. Now I'm going to try to move your head to the right, but don't let me, okay? Good. I'm going to try to move your head to the left. Don't let me, okay? Great. All right, so what I want to do is I want to check your vitals. So I'll have you just hold still. Checking your temperature. 98.5. Now I want to go ahead and check your oxygenation. So I need your index finger to go in here, okay? Let me just put that right there. Okay. All right, we're at 99 and BPM is 93. Absolutely wonderful. You're very healthy. Now I'm going to go ahead and just have a feel of your face and just looking through your hair, checking to see if I can find any moles or anything concerning. I'm not seeing anything. The hair distribution is perfect. You have the most clean scalp I've ever seen. It's just absolutely perfect. Okay, now I'm going to tap on your face. I want you to tell me if you feel any pain at all. Any pain? Okay. I'm gonna have a feel of your clavicles. Just right here. I'm just gonna move your shirt. Just gonna move the shirt out of the way. I'm gonna have a feel of your neck. Just having a feel of your thyroid glands and your clavicles. Checking the thyroid glands right here. They would be right here. From your neck down. Have a feel of your arms really quick. Any pain? Good. Can you wiggle your fingers? Can you wiggle your fingers again? And clap. Can you clap? Good. All right, let's go ahead and check your eyes. So what I'm gonna do is I'm gonna have you take a look at this light. Can you see it? Okay. I want you to just follow it with your eyes, okay? Good. You're doing so good, by the way. I'm so proud of you. I just love that I get to do this exam on you. You're my favorite. You're my favorite patient. Did anybody ever tell you that? Okay, continue to follow. Don't get distracted. Good. Now, I am going to take a look inside your eye. Okay? I'm going to pull your eyelid down, and I just want you to look up for me. It'll be really quick. Pulling down and looking. Looks good. Pulling down and it looks good. I am going to take my ophthalmoscope, though. I am going to have a closer look. Okay? So I'm just going to come in real close. Is that okay? Perfect. Okay, so it looks like the eye looks really good, not dry at all. And I'm not concerned. The optic nerve looks absolutely perfect. It looks intact. No popped blood vessels. Okay, no concern with that eye. Now, do you ever suffer with dry eyes? No. Yeah, your eyes looked really good. Your eye looked really good. Let's check your other eye. Okay, so we're just taking a look at the other eye. And I'm not seeing anything concerning. Everything looks great. No abnormal redness, no bumps. Okay, can you blink for me? Okay, perfect. Now I am going to have you look at my nose. Can you do that? Good. I'm going to move 2 fingers. Either these 2 or these 2. I just want you to look at my nose and tell me which fingers you see moving, okay? Good. 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 Very good. Good. Okay. Continue looking at my nose. And then tell me when you do not see my fingers in your vision. Good. Good. Perfect. Now I have a Snellen chart I'd like for you to take a look at if you could. Can you see it? Okay. Can you tell me what letter this is? All right. How about this? And can you read this whole bottom line? Amazing. And this letter here? E. It's pretty big. And then can you read this line here? Good. And this line? Okay. And can you point to the biggest circle? Okay. And point to the smallest one? Okay. And what color is this? Red. Good. I do have some sheets of paper here. They're different colors. I'll just have you tell me what color they are. Does that sound good? Ready? Good. Green. Yellow. Orange. Pinkish purple. Dark purple. Light pink. Blue. You're doing amazing so far. Let's go ahead and do a really quick sharp or dull test before we move on to the nose and the mouth, okay? So tell me, is this sharp or dull? Good, and how about this? Okay, how about this? And is this sharp or dull? How about this? Okay, how about this? How about this? And this? And this? And this? And that? Very good, you got all of them right. I'm so proud of you. We're gonna move on to your nose. Okay, so I'm gonna have a feel of your nose. I'm gonna have a feel of your sinuses actually too, just to see if there's any pain. All right, can we do that? All right. Any pain on your nose at all? Oh, let's take a look inside to see if there's a deviated septum or anything like that, which I'm sure there isn't, but let's go ahead and take a look. Okay, so I'm just having a look at the nose. Not seeing any crumble discharge. Everything looks good. Okay, let's check the other side. Okay, so I'm just having a look under the nose. Okay, so I'm just having a look in the nose here. No deviated septum. No abnormal discharge. No scabbing. Your nose looks great, by the way. Let's go ahead and do a smell test. Can you go ahead and tell me what this smells like? And just breathe in. Does that smell like peppermint to you? That's exactly right. I have one more tincture here. It smells just a little bit different. Does this smell like chocolate to you or peanut butter? Yeah, it's peanut butter. Love that. I'm obsessed with peanut butter, by the way. Okay, last but not least, we're gonna do a really quick nose swab. Have you ever had one before? Okay, well, it's really simple, okay? So all I do is I just take one of these nose swabs right here, and we do one nostril and the other, and we send it to the lab just to make sure you don't have any viruses or anything like that, okay? All right, let's go ahead and do the nose right now. Very good, you did amazing. We're almost done, okay? Perfect. Okay, you can itch your nose if you need to. All right, I'm just gonna send this on over to the lab. Next, we're gonna move on to your mouth. I wanna have a look at your teeth and your just overall gum health. Okay, so let me go ahead and use this to hold down your tongue so I can also look at your tonsils. All right, so I'm just gonna have you relax while I just take a look into your mouth. Okay, wow, your teeth look amazing actually. Very good. You must brush them often. Do you floss often as well? Wow, they look amazing. Absolutely amazing. They're so pearly white. Okay, now I'm going to pull down your tongue and just take a look at your tonsils. Oh wow, your tonsils they're in good shape. For sure, they're not red or anything like that. Have you ever had tonsillitis? Gotcha. Okay. Okay, the next portion is your ear exam. So what I'm going to start off with is just taking a look into your ears just to see what we're dealing with here. And we can definitely do an ear cleaning as well. If you've got lots of buildup, we might have to do that before I can see the tympanic membrane. But let's go ahead and take a look. Okay, so I'm just taking a look inside the ear here. Oh wow, we do have a little bit of earwax. I'm just gonna pull your ear back a little bit because we do have a little bit of earwax. I'm just gonna pull the ear back. Okay, I can't see the tympanic membrane on this side because it looks like we do need to clean it out just a little bit. That is no problem at all. I have all the things I need to clean out your ears. Let's go ahead and check the other side. Okay, Okay, so it looks like this ear also has quite a bit of earwax buildup. Okay, can you hear this? Hardly. How about this? Okay, so let's go ahead and do another test really quick. Can you hear this? No? How about this? Okay, how about this? Do you hear this? This? So I think we have a little bit too much earwax and it's stopping you from even hearing properly. So let me go ahead and flush those ears out. So we're gonna start off by, we're gonna be wetting a Q-tip, and we're just going to go in with the Q-tip first to get any of the crusties out of there. So let's just use the Q-tip here. I wanna make it wet. Okay, let's go ahead and start cleaning out the ear here. Okay. I think I've got a piece that I'm trying to get out. Oh, I definitely got quite a bit out. Let me go ahead and get rid of that. So let me use this to do the other one. I'm just going to be trying to get rid of that earwax there. Are you doing okay? Perfect. We're almost done with this part here. We're just getting rid of all the crustiness, so we can go and flush out the earwax. Okay, perfect. Let me go ahead and put in some oil. So this is olive oil, and I'm just going to put some into your ears so that we can soften up the earwax, okay? Now normally I recommend people doing this a couple of days beforehand, but this works as well, okay? Just go ahead and put some oil in your ear. Are you doing okay? Okay, now let me do the other side. And are you doing okay? We're almost done with this portion here. Good. Ooh. Let's go ahead and let that sit for a minute, okay? And what I'm going to do is I'm going to take another look into your ear to make sure that the oil is working. So let me just take a look into the ear here. So the oil is definitely working. Looks like it's definitely softening everything up. Perfect. I'm just going to have a feel of the ear. All right, let's go ahead and check the other side. Have a feel of the ear here. Let that oil soak in. Okay, so now what I'm going to do is I am going to go ahead and flush the right ear. So let's just start off by flushing the right ear. So I'm just going to start off by flushing this right ear. And are you feeling okay? All right, your ear's not itching or anything like that? Gotcha. Okay, now that I've washed it, I'm going to scrape out the rest of the earwax, okay? Oh, I got a big chunk there. Oh, that ear must probably feel really good. Yeah? We'll take a look in a second. Let me just go ahead. Let me just go ahead and clean out this one, okay? How does that feel? Does that feel good? Does it feel okay for you? Okay, let's go ahead and get rid of the last earwax on this side. So that one isn't really working. I'm going to actually have to go grab some of my more intense tools. I'll be right back. I didn't think I would need to use this. However, I do pull these out when needed. So we're going to go ahead and use this right here, as well as this one. Okay, so let me just go in, try to get that little piece out that we've been looking at. Just going to try to. There we go. Does that feel okay? Okay, perfect. Okay, I'm going to use this to just scrape that out. Ooh, I got it. Very good. Go ahead and get these disinfected. And I'm just going to spray the inside of the ear here to try to get it as clean as possible. And the other side. Okay, and one more quick clean out here. Both sides. All right, I think we've got everything. Let's go ahead and take a look. Oh wow, yeah, it looks so much better. Can you hear this? How about this? Oh yeah, that's so much better, isn't it? Let's go ahead and check this one out. Oh wow, looks great, for sure. Can you hear this? How about this? Right. Let me go ahead and whisper some things into your ear to see if you can hear them, and I want you to repeat them back to me. Let's go ahead and get started. ASMR. Gorilla. Green. Purple. Blue. Yellow. Very, very good. So your ears, do they feel any pain at all when I tap on them? Any pain when I tap on the ears? Just want to make sure that I'm not leaving you with any pain at all. We were very gentle. Very, very good. Okay. Let me go ahead and write down some notes. Okay, so the cranial nerves are perfectly intact. Not finding anything wrong with the eyes. So mouth, teeth looked beautiful. Throat, everything looks perfect. And the ears are clean. And no pain in the ears after all that, right? No pain at all? Perfect. And you can probably hear me better, huh? Alright, well, it was very, very amazing to see you again. I'm so thankful to always have you in our office. You are my regular, and I just love having you here. What we're gonna do is, I'm gonna take my gloves off. I'm gonna have you actually go and schedule another cranial nerve exam for a year from now, just so that we can keep up with everything. How does that sound? Yeah, sounds great. Well, thank you for coming in, and I hope that you have a wonderful rest of your day.